Welcome everybody again this evening. I'm Dr. Jeff Lehmkuhler, one of the beef extension specialists here at UK and part of the Mid-South Stalker Conference Committee. And we want to welcome you on behalf of the University of Kentucky, the University of Tennessee, the Mid-South Stalker Conference, Western Kentucky University, and our other industry partners to the webinar. This is part 2. If you happen to miss part 1 last week, we will be sending out the links to the videos. Once we get those downloaded and processed, we'll break up the videos into each speaker so that they're not as long, and it'll take us a couple days to get those out to you in case you want to go back and view last week's and or brush up on this week's. So it's my pleasure this evening to introduce Dr. George Perry. Dr. Perry grew up in let's see, the south central part of Texas. He received his bachelor's from Texas A&M, and then went on and did his master's and doctorate degree at the University of Missouri. That's where Dr. Perry and I crossed paths. We both did our graduate work at Missouri, MIZ. And George then went on to continue doing, while he was doing his PhD work, he did a lot of work in Montana at the Miles City Station up there. He then went on to South Dakota State and was on faculty at South Dakota State, probably one of the areas with the largest extremes with regards to coldest winters and hottest summers. And then he had the opportunity to get closer to his roots and is now with Texas AgriLife at the Overton Research Station. Dr. Perry has done a ton of research in the reproductive physiology area. He has really a good practical outlook on research and its implications on beef cattle production. If you missed his presentation back when we had him on for the UK beef webinar series a few months ago, it was a great presentation. You can find that up on the department's website. But we thought with the interest in kind of heifer development and the potential for growing the mature cow herd back, that his information that he shared would be very timely for our backgrounding and stalker folks too that might be looking at diversifying their marketing strategies on some of these heifers and thinking about developing heifers, as we might see the potential for some expansion in the coming years. So with that, Dr. Perry, I'm going to turn the program over to you and let you take it from here.
Well, thank you very much, and I appreciate that introduction. And yes, I spent 17 years at South Dakota State, and one of the interesting things is especially in the vaccine area, we did it in the extreme cold up there. We've done it in the extreme hot down here, and we're seeing the same effects. And so, what I was kind of asked to talk about today was vaccination and their impact on fertility. And you may wonder, well, is that just a direct effect in that? And what I really want to show is, a pet peeve of mine has always been, because my training is in reproductive physiology, is reproduction heritable? And this is a graph that Dr. Cushman put together a few years ago, looking at heritability of different reproductive traits. And if we look over here on the left, antral follicle count, we can do that in animals pretty much as early as we can get an ultrasound into them. Age at puberty, we come all the way over here to pregnancy rates, and we see heritability goes down. Well, one of the reasons heritability goes down is as we go across here, one of the things that gets in the way of reproduction is management. And so there's a lot more management that affects pregnancy rates than antral follicle count, because that's set by genetics. And so as we're looking at the reproductive cycle, and especially as I was asked to talk about tonight on building the herd and heifers, we're really looking at setting up heifers for longevity and setting them up to be productive in our herds. And so what I want to go through is, how do we set them up? How do we make sure they're set up correctly and have the best impact? Well, as we're looking at reproductive diseases, we look at a lot of combination vaccines. We have stuff to cover BVD, IBR, lepto. Vibrio. We don't really have a vaccine for trick or neospora, but those are the ones that really come into play that everybody thinks about for reproduction. And I've got friends in the pharmaceutical industry, and when we think about our cow herd, and especially if as we start rebuilding it, we vaccinate the cow herd to have reproductive performance. We're not worried about growth. We're not worried about average daily gain. We want that calf out of them, and we want a healthy calf. And so when we think about it, we're really looking at fetal infection and pregnancy losses. But when we think about the two viruses here, BVD and IBR, we can actually affect the ovary. And we can have dysfunction of the ovary, we can have dysfunction of estrous cycles to the point that we have negative consequences on our reproductive performance. And so when we think about vaccinating, most IBR and BVD, which is what we've really looked at, is the viral vaccines, they're in a combination vaccine. The labels all read 30 days prior to breeding. There or about. Some of them will say 4 weeks, some of them will say 28 days, but give or take, they say about 30 days prior to breeding. And so as we're looking at that, we have two different types of vaccines we need to consider. We have modified live, and the dogma with a modified live vaccine is it's much better at cell-mediated immunity. So your viral type infections. There's flexibility with the booster, but we also have to be careful because we're handling a live virus. And so we give that live virus, we give it to the animal, it starts replicating in the body recognizes it, and our hope is that the body fights it off before it builds up too high. So an animal that already has some exposure will fight it off quicker. The other side of things is actually our killed vaccines. And our killed vaccines, instead of allowing the virus to replicate in the body, we just give them a bolus dose of the virus that's been all chopped up. And the body recognizes different fragments of it. And so we get a better antibody mediated response. The thought is we need more boostering because the body does not see the replication, but they're much safer. We don't have to worry about going back to virulent stages. We don't have to worry about the handling as much because if that virus is chopped up, it's dead already. We're not worried about keeping it alive where it has to replicate in the body. So then the question has really become, what impact do those have reproductive? Because when we look at the labels and we look at what FDA requires for a label, it requires us showing that you give the vaccine, they produce antibodies, and they decrease the impact on the animal. None of them really have looked at what impact does it have on reproduction. And I asked some friends of mine that are in the pharmaceutical industry, where did that 30-day come from? And I've gone back to the 1960s and 70s when they first started coming out. And as I'll show you, excuse me, here in a minute, the early work on modified live vaccines showed that if we give it to naive animals, that impacted the corpus luteum. And so the thought was, okay, the estrous cycle is 21 days. Let's get past that estrous cycle. We go back to having good fertility. But it was never really looked at in a lot of detail. There were a couple of companies that did. But when we look at what we know, we can go all the way back to studies in the early 80s. And if we look, if a live IBR was injected into heifers the day after estrus, ovarian necrosis occurred in 7 of the 8 heifers. Same year, modified live vaccine of IBR given to 8 heifers day after estrus, CL and ovarian necrosis in all 8 of them. Modified live vaccine for IBR given to 18 heifers day 4 after the second prostaglandin. So if we think 2 shots of prostaglandin for synchronization. About 72 hours later is when most of those are going to come into heat. So we're around the time of estrus. CL, ovarian necrosis, inflammation in 14 of the 18 heifers. Again, vaccine for IBR given or a control, 19 heifers, day of the second prostaglandin. So this is before they came into estrus. Of the vaccinated heifers, only 3 out of 10 calved, were all of the controls calved. Again, modified live IBR, 8 heifers, day 14 after breeding, infertility, embryonic death, and returning to estrus. Our first study, and I'll go into this one in a little bit more detail, we actually compared the modified live to a killed IBR vaccine in 59 heifers given on day 1 of a synchronization protocol. And I'll explain why we did that when I go through the timeline. But what you'll see is abnormal cycles were greater in the modified live and much fewer of them conceived. And so when we talk about necrosis in the ovary, it's not that we're killing the ovary. What we're really talking about is when the follicle ovulates, the corpus luteum that forms later. And so up here in this top picture, these bigger areas, those are our large luteal cells. That's what makes the progesterone. That progesterone is needed to maintain a pregnancy. If we look down here, we can see all this black area inside the corpus luteum. That's necrotic tissue inside that corpus luteum, which means that CL is not healthy. And so we can see here in this Miller paper, IBR given, CL damage, lesions. We can also see immune cells invading the area. And we have to remember, if you think back to when you took repro, at ovulation, the first thing that it's called after ovulation is a corpus hemorrhagica. Because what that does is that follicle ruptures, and it's called that because it's like a hemorrhage. And so we actually have a lot of immune cells coming in. And what I want to explain today is as we vaccinate, we really ramp up the immune system. Well, if we have something else going on that the immune system's involved with, what we do is we seem to mess it up. And so I want to go through those steps, and we can see as the necrotic tissue, these lymphocytes are invading. We don't want that if we're at the start of the breeding season. And so there's several reports all the way up through the early 90s or late 90s talking about vaccination and damage in the ovary. And usually that has occurred when these animals were naive. And so when we're talking about heifers, and a question that always comes up is, what is your definition of a naive heifer? A naive heifer is one that has not been vaccinated before. And I usually take that a step further and say, okay, if you have not given the vaccine, we need to consider her to be a naive heifer. Because I've seen numerous cases, I've been called into several herds that they've bought heifers from the sale barn, and the sale barn said, oh, they've received all of their vaccines. What does all of their vaccines mean? Probably the worst case scenario was when I was in South Dakota. A herd bought in 300 bred cows out of Montana. They were mainly heifers, and they were said, oh, they were all vaccinated like this prior to the breeding season. And if you look at the labels, several labels anymore on modified lives will tell you that they're safe to give in pregnant animals. So they trucked them from Montana into South Dakota at time of preg check. They came off the truck, they preg checked them. They said, well, we're just going to booster everything again. We're going to give them the exact same thing they were given. They aborted 100 of 300 cows. That's a tremendous loss economically. And when they started checking, it was there, oh no, we used a different vaccine this year. That's not what we gave pre-breeding. And so I really emphasize, if you haven't been the one to give it, you really need to question what was given. And what we can see here in this picture, these brown spots are actually the BVD antigen that can be picked up in the ovary. And so we know for some reason these two viruses really like the luteal tissue. And you can see where have actually been able to find the virus inside the corpus luteum even 10 days after vaccination. So, with all of that work that was done, our first big study looking at it was with modern synchronization protocols. If all we're doing is really disrupting the corpus luteum, can we do things, reduce number of trips through the chute? Can we do it at the start of synchronization? Because if I come in here on day 0, when I put a seeder in place, what do? I give a shot of GnRH. That shot of GnRH should cause ovulation of this follicle. If this CL that forms here is subluteal, it doesn't really matter. We have a seeder in place to make up the progesterone. This next follicular wave that's growing doesn't ovulate till about 9 days later, because you have 7 days of a seeder. And then by the time they come into estrus, you're 2 to 3 days later, we should be fine. Well, what we saw is we had multiple treatments. We had our modified live, commercial vaccine of Shield. We had the commercial vaccine of Virus Shield. We gave them either 1 or 2 doses of it. And then we had a control group. And if we look for abnormal cycles, we can see the modified live group, 40% of the animals had an abnormal cycle. This is an abnormal cycle after seeder removal. And so when we're looking at that, what impact is it having compared to our control group, which just got saline? There were no abnormal cycles. Our killed vaccines, whether they had 1 or 2 doses, we were at about 10 to 15% with an abnormal cycle. What that means is this green line here is our control. Progesterone should rise after ovulation and stay elevated. There's going to be daily fluctuations. But if you look at these red lines, they're all dropping off early, or the yellows down here dropping off even earlier. If that corpus luteum regresses prior to day 16, there's no chance for maternal recognition of pregnancy. If you can't have maternal recognition of pregnancy, that animal's just going to cycle back just like you never even bred her. And so when we looked at pregnancy rates, there were 40% abnormal cycles, but as far as conception rates to that first AI, we were at about 30% in the modified live group. The killed, even though we had 10 to 15% abnormal cycles, there was not a statistical difference, and that's due to numbers, with our control group. And so we see we were doing, now, when you look at this and say 70 to 80%, I'd love to get 70 to 80% all the time on my AI. These animals were everything possible thrown at them to make sure that there was correct semen in place. They were, after seeder removal, they were AI'd. At about 60 hours, they were AI'd again 24 hours later. And 24 hours later, a bull went out with them. So if there was a chance for them to have semen present, we optimized everything. And so when you throw that much semen into them at those time points, to only have 30% compared to 70 or 80, there's a huge impact at the start of the breeding season. Okay, well, we know 40% of these animals had abnormal cycles. We know when they came back into estrus because we were taking blood samples every other day. That second service, so the fertile bulls out with them, we were only at 40% that conceived to that second service, compared to the ones that had an abnormal cycle in the killed vaccines. Granted, there's only 1 and 2 animals in there, they conceived. And so what it really did for us and for the industry is it changed the dogma. The dogma was always if we vaccinated a heifer with that first vaccine, we disrupt the luteal function, and the next cycle she should be fine. Well, when we came in here and we vaccinated, at the time Cedars went in, we knew we would disrupt this CL. What happened though is in 40% of the modified live animals, we actually disrupted this CL and we impacted conception rates on more than that. And then what really surprised us was out here this second service with bulls out with them, we were only at a 40% conception rate. And so the idea that giving a modified live really likes that dominant follicle and really impacts that one follicle changed because we were impacting things out 30 days later. And we were having negative effects on these animals. And so when we look at this and we look at follicular development, we know we need to get vaccines into them early. And if they're naive animals, if you have not previously vaccinated them, we really need to stay away from modified lives near the start of the breeding season. And when I say near, we know 30, 45 days before the start of the breeding season, we're going to have negative effects if they have not been vaccinated. After we finished that study, the question really came, okay, what about previously vaccinated animals? What about our cow herd or heifers that we vaccinated at weaning? And when I was in graduate school, there were 2 papers we always referenced. One was this one that looked at 40 days and 3 days prior to the breeding season. So they gave a modified live either 40 days or 3 days before the start of the breeding season. No difference in conception rates, first service, second service. No difference in days to conception. Another study that Dr. Stormshack did in Kansas, they came in at 30 days or 9 days pre-breeding. Same thing, they gave a modified live, 30 days or 9 days. Again, 300 heads, so large numbers in these. No difference in estrus expression, no difference in AI pregnancy, no difference in breeding season pregnancy rates. One of the things, though, about these 2 studies is all they were looking at was timing. There was no control group, there was no killed vaccines. They were literally looking at 2 different time points. And so more recently, there's been a couple of studies done that had small numbers, but that actually compared modified live to killed vaccines. And here's one. If you look, there were only 60 head total. Over here, 40 days and 10 days pre-breeding, or 61 and 31 days pre-breeding. Modified live versus killed, a 20% difference and a 15% difference. But if you read the paper, statistically, there's not a difference in conception rates because we're talking 20 head. A third study, given there was 60 head in the modified live, 15 in the saline, they had a 20% difference. Again, statistically, it's not different. And so when we started looking at those papers, it was kind of, okay, is there a difference? And so we wanted to look at what was going on if we had large enough numbers. More recently, actually just, 2 years ago now, in 23, this paper came out of the Virginia prison herds that actually showed modified live and killed given at the start of synchronization, no difference in spring or fall. What's interesting in this study, they had large numbers, but they actually ran their modified live and control. They didn't have a killed vaccine. They just did modified live versus controlled. They were all being run together. And Chris Chase presented at the World Pediatrics Conference this past year a study where they actually had modified live vaccinated heifers in the same pen with naive heifers that had never been vaccinated. And at the end of the study, they had all seroconverted. So what does that mean? At the end of the study, all of their naive animals had antibodies showing that they had been basically vaccinated or exposed to the virus. So when we give a modified live to an animal and it's in the same pasture or the same pen as other animals, there's chances for them to shed and actually expose the other animals in that group. Now, if we're looking for herd immunity, this is a good thing because now, even if an animal doesn't respond to the vaccine as well, we get that exposure to build it up. But we need to be able to balance it for a research study to know what impacts it's having. And it really helps us explain the first big field trial we did. Because our first big field trial, we were looking at a modified live versus a killed vaccine. And we had a saline group as our control, thinking, okay, we're going to give saline. They've been vaccinated last year. We're not vaccinating them at all this year. There's about 1,500 head in this study. There was 9 different ranches across South Dakota and North Dakota that participated. They were all vaccinated exactly 30 days before the start of the breeding season. If we look at AI conception rates, it's about 10% lower in the modified live compared to the killed vaccine. Our saline group ended up being intermediate. And since we published this paper back in 2013, I've always been questioned about this group. Well, now it makes more sense because if this modified live group was shedding some, the saline group was just like they were getting vaccinated. If we look at 56-day pregnancy rates, and what's important about 56-day, this was when we ultrasounded, we could tell AI conceptions plus the first bull bred. And if we look, both the saline and the killed vaccine were statistically higher than the modified live. And at the end of the breeding season, we're back out where killed was the highest, modified live was the lowest, and saline was intermediate. But honestly, if we look at this, I don't think anybody'd complain over 90%. We followed that up with a second study looking at just a modified live and killed. We had taken the saline out, another 1,500 head. And so again, we saw about an 8% difference in AI conception rates early, no difference in breeding season pregnancy rates. What was different about this second study is we worked with cooperator herds, and they were vaccinated anywhere from 28 days to 85 days before the start of the breeding season. We still saw this effect on AI conception rates, but it was gone before the end of the breeding season. And so what we've really been trying to do lately is figure out the mechanisms. And so Caitlin Epperson, who just graduated a couple of years ago with me, her first study, we really compared modified live to killed in a more controlled setting. And we actually had 24% of our previously vaccinated animals still have an abnormal estrus cycle. And so when we think about that, these animals had been vaccinated every year of their life, had every year gotten their boosters and everything. We still had 24% that had an abnormal cycle when they were vaccinated. 21% regressed their CL before maternal recognition of pregnancy. 3% had a delayed rise in progesterone after ovulation. But on top of that, if we look at progesterone concentrations, if we have all the animals, it's not surprising that there's a difference in progesterone concentrations, those in the killed versus the modified live. But if we remove this 24% and we only look at the ones that had a normal cycle, there's still decreased progesterone. And so we're still impacting that corpus luteum. And if you look at our every other day bleeds, you can see we have a nice rise in progesterone, but it never gets as high and doesn't come up as early as what it did in the killed vaccine. If we look at titers, we know the vaccines work fine. Here's our control group, no changes in titer concentrations. If we look at our IBR, our BVD titers, the vaccines worked. What was interesting is we came in on day 11 and we overectomized some of the animals. We wanted to look at the corpus luteum and see what was going on. And if we look, here's our control animals. We see some beautiful large luteal cells. These are the cells making most of the progesterone. If we look at our killed vaccine, our inactivated vaccine, we still see nice large luteal cells, but you see all these other black dots? That's all immune cells coming into the CL. When we look at the modified live, these large luteal cells are real frothy. They don't look healthy at all. And so we can see we are having an impact on the corpus luteum when we're vaccinating these animals at the start of the breeding season. And if we look, our controlled had the largest number of large luteal cells. Our modified lives had the fewest total number of cells. Our killed actually was the greatest because of all the immune cells coming in. So if we look at the percent of the corpus luteum that was large luteal cells, we see it's greatest in our control. We need that progesterone to maintain a pregnancy. And so what we've really been looking at is basically the cytokines, the immune system, and how long we're impacting things. And so we've been doing a lot of things. Caitlin had 44 animals in this study, day 2, 6, 12, 18, and 22 after vaccination. And if you look at some of these, a modified live normal versus abnormal, how much we change the immune response in these animals that had the abnormal cycle. And so these cytokines signal throughout the body, and we know they can have a direct impact. And interferon gamma is actually one that has been shown in dairy cattle. In when they have mastitis, interferon gamma is upregulated, and we see decreases in conception rates. And so by vaccinating, we're having some of the same system upregulation as if we were fighting off a disease in the animals. And so that's where we're upregulating that immune system so much. So Caitlin's final study of her PhD was rather intense. We vaccinated, we came out 28 days later, challenged a different group, and seeing how well things carried out. And then we collected every part of the immune system. We looked at antibodies, we looked at different immune cells, and we looked at cytokines. And we can see the whole different profile of things. And what I really want to bring out is there's more to the immune system than news media, and we always talk about antibodies. But our antigen presenting cells, our natural killer cells, our T helper cells, whether they're activated or not, are really important parts because that is the body's defense system. And when we look after vaccination, the treatment was either a modified live or killed. And this is from day 0 to 14. We can see we're impacting not only by treatment, but it's different between the treatment and days on these different cell types, our antigen presenting cells, our activated T cells, and our activated T helper cells. So we really do change the immune system And again, looking at the cytokines, one of the top ones that came up was interferon gamma again. And just to show you what does that look like, this response of interferon gamma, look at these animals in this modified live group, how dramatic of a change it is compared to our controlled and our killed vaccine. And so when we do that, and we can see that in a couple of our other cytokines too, where we have this dramatic response, what we're actually looking into now is that we are driving the immune system far enough that when this corpus luteum is forming, these cytokines are having negative impacts on it. And so this inflammatory response then interferes with our reproductive efficiency. And so, really, when we get down to it, the question becomes, how should I set up animals? When should I administer pre-breeding? Well, replacement heifers need to be vaccinated before or at weaning. And if we look into the literature, and if we think about how a modified live vaccine works, if we can get a modified live into animals around the time of weaning, we allow the body to see how that virus replicates. We do that as their first vaccination. That gives them time to recover from it. If we're going to continue with modified live, and we can have a whole different debate on whether we should continue with them or switch to a killed vaccine. But an animal that has a good immunity, as a modified live is given and that virus starts replicating, the body's going to attack it right away. So there's actually some really good literature that we get a better immune response when we give a killed vaccine for the second prior to breeding, because then we give them the bolus dose of those chopped up virus particles. But we still recommend we want to be at least 45 days before breeding. And then again, I would just want to reemphasize, if an animal has not been previously vaccinated, we really need to be cautious at the start of the breeding season. Definitely stay away from modified lives, but I even caution against the killed vaccines if we get too close. Even though we haven't seen a difference in reproduction, we know we are impacting the corpus luteum. So you may question, well, the label says 30 days. Why am I saying 45? When we look at the study we did, and again, there's over 1,500 cows in here, and we're just wrapping up a study that we're adding more cows to this study so we can do a meta-analysis. We vaccinated everywhere from 27 days to 89 days pre-breeding. This was working with cooperator herds across South Dakota and Minnesota. When we look, the cattle master, which is a killed vaccine, or considered a killed vaccine, was better at all time points. But even the killed vaccine, when we got out past 45 days, we saw an increase in conception rates. The modified live, there was an even bigger increase when we got out past 45 days. So as we think about this, as a reproductive physiologist, one of the things learned early was, what is follicular growth in cattle? Well, it's 42 days from pre-antral to pre-ovulatory size. It's 90 days from activation to ovulation. So these small follicles, once they get activated, we're talking 90 days for this whole cycle. But from here, just before the antrum forms to ovulation, is 42 days. As I mentioned early, we know these viruses like this environment for some reason. If we're out to 45 days, we're before this antrum is formed. We've allowed all of the follicles that were in these stages to clear out of the body before we get to the start of the breeding season. We can see here a study in dairy cattle. Uh, Quite a few animals in this study given 45 days prior to AI, modified live versus a killed. No statistical difference. So 44 versus 47% on dairy cows, which is good conception rates. And so, as we're thinking about that, we need to develop these animals to build the herd immunity. And so, when people ask me for my opinion, I really like modified lives around weaning. I like switching to killed pre breeding. And so, if we think about developing our heifers, we really prime both sides of the immune system before that first breeding season. And we allow the best immune protection possible going into that first breeding season. We need to get it done early. But really need to question is, and we really need to think about biosecurity, because are vaccinated animals totally protected? So if we have an animal here that's vaccinated, but your neighbor does nothing, what are you exposed to? And this is a herd I got called into, 3 years ago now. And when we look at this picture, does anything stand out to you? You may not notice right away, but there's 4 carcasses looking from their fence onto their neighbor's property. And what actually happened is, even though they were vaccinating, they ended up with a BVD infection in their herd from exposure to their neighbors. Because without biosecurity, we can overpower any vaccine response. And to show you how that can happen, actually, this is what got Caitlin started on that line during her master's degree. We were looking at a project that we were trying to do 2 rounds of fixed time AI. We had 9 herds involved. You can look, they were all vaccinated, modified live, killed vaccines. It was up to the herds what they did. They were all done 30 to 45 days prior to the breeding season. And when we went out and we started preg checking, we had some horrible conception rates. And so we came in and we tested these herds, and we actually had 4 herds that were positive for BVD antigen during the breeding season. And if we look first service conception rates in those herds, there's over a 20% difference in conception rates. First and second, remember we were doing 2 rounds of fixed time AI. We're at a 17% there. And for the total breeding season, we were right at a 20% difference. We were fortunate to be able to follow some of these. And the cows that were exposed, none of them had a PI calf. So the vaccine worked as it was supposed to. But what does a 20% loss in conception rates cost you? And so we need to build that immunity the best we can, because anytime we get exposure, we're relying on this cow's immune system to not only protect her, but to protect this calf in utero, keep it alive, but to try to keep it from becoming a PI when it's born. And even though I show a picture of this herd, just this past fall, I got called into a herd just down the road. They knew their neighbor had a BVD problem. They actually have a 12-foot wide gap that they graze horses, and they had a PI calf born this year. The only thing they can figure out is one day they went out and the coyotes had drug a calf from the neighbors into their property. And so we need to be careful of making sure we build the immunity we can in ours, because we can get exposures. And unfortunately, viruses don't recognize a barbed wire fence and say, hey, I shouldn't cross. They go where they want to. And so as we think about all of those things, it is putting the best vaccine program together along with biosecurity that allows us to maintain our healthiest herd possible. And so with that, whoops, There's lots of people to thank, lots of funding agencies. This second column here is really the grad students who have to run around and do all the blood collections and all the labor so I can talk about things. And then all of our collaborators. And with that, I'll be happy to answer any questions.
Thank you, Dr. Perry. And just as a reminder, use that Q&A area, type in those questions, and we'll make sure to address those as they come in. Dr. Perry, what about, have you dove into the literature? I know this is more on the female side, but are there potentials to have ramifications on male fertility as well?
My current grad student really wants to look into that. We just finished up a study and we had two bulls here at the center that we were going to sell. And so we just vaccinated them. She just got back from Clay Center running cytokines. We have not analyzed the data, but we can definitely measure. We know cytokines are very involved with spermatogenesis. And so we actually have a USDA proposal in right now, depending on if it gets funded or not, to look at that. Actually, in collaboration with Salo, they're at Tennessee to see if cytokines are impacting spermatogenesis. Uh, if the cytokines that we're really impacting are playing a role, but we just finished, like I said, we just finished measuring cytokines in seminal fluid, and so we know they're there, but I can't tell you exactly what levels they'll be having impacts. But we are looking into that in more detail.
Dr. Perry, there's a question that came in regarding the current thoughts on using an MLV on a nursing calf where it's still with the dam. Has that been looked at, or do you have any suggestions on that? And then, um, also, I guess, the thought process of a modified live versus a killed for that calf, doing that
So
pre-weaning, right?
So we have done that. I've talked to all the pharmaceutical companies. If cows have been well vaccinated, if the cows have had their annual boosters, whether it's killed or modified live, there are no reports and no cases of negative effects of giving a modified live to that cow. Now, if the cow is totally naive, if the cow has never been vaccinated, if you go back in the literature when modified lives first started coming out, there are cases of the calf shedding and causing problems. In the one study I showed where we had that saline treatment, all of those calves were given a modified live 30 days prior to weaning. We had no negative effects. But like I said, they were given saline that year, but they had been given an annual booster every year up until that year. And so, as long as we build proper immunity in the cow herd, I don't have any concerns with giving a modified live to the calf pre-weaning like a lot of people do. It's if you know nothing about those cows, then yes, we need to be concerned.
Well, Dr. Perry, there's a question that came in with regards to then, your discussion that you kind of introduced the topic with in regards to the manufacturer's labels and recommendations on wind. Do you think that this work will lead to some potential changes in those labels?
Uh, as far as changing the labels, that's FDA's issues in that, and for FDA to change the labels become some major things. If you look, AABP, which is American Association of Bovine Practitioners, last year, well, no, we're in 25. So in 23, they released the first manual that gave recommendations to build a vaccine program for cattle herds. They did reference all of our work in there, and they did reference getting animals vaccinated at least 45 days prior to the start of the breeding season and being cautious of modified lives prior to the breeding season. And so, as far as actually changing the labels, that's between companies and the FDA, but the recommendations going out to veterinarians and that we are getting the word out and things are getting recognized. And so I think it's going to be more changes through your veterinarian than what the labels actually say.
Another question came in with regards to some of the products that are available with the fetal protection component, and what do you feel about that with regards to protection of the calf, and then also the potential impacts on breeding?
So the fetal protection labels, uh, when they have that label, they've actually done the studies with FDA to show that when a cow is pregnant, the calf that is born uh, should not be a PI. With that, what we've seen is just like in Caitlin's master study, the herds that I've gotten called into where there's been issues, and we had a herd around here 2 years ago, had the same thing. They got exposure during the breeding season. Why I got called was because their conception rates were really low. And I've been trying to figure out a way if there's a way to test it. I think the labels that have fetal protection do a good job that way. And actually, the way I think the body handles it, and I don't know a good way to test it yet, is I think a lot of times you end up with lower conception rates because the body ends up losing those calves, ends up aborting them. So you have lower conception rates. The ones that make it all the way to term, like I said, when even in Caitlin's, the calves we followed the next year, there weren't PIs born. They were all well vaccinated heifers, but we ended up giving up 20% in conception rates. So I think that label is good. I think it does work. I think if you have the exposure, where you're going to suffer is the conception rates. That's where the biosecurity comes into play. And I think we need to put it all together to have our healthy herd.
One last question before we move on. There's some recommendations, particularly in areas maybe where you have a higher level of lepto exposure, to use maybe a killed vaccine or vaccinate twice a year to continue to boost that immunity. Do you think that has any potential to have any ramifications?
Uh, I think there's some benefits to it. I've worked with several herds that have started doing that. The other big benefit to a killed vaccine at preg check or later in the year is really boosting the antibodies into colostrum. So I think there's better benefits if you have good biosecurity where you can get an increase in the immune system prior to colostrum formation, getting that into the calves to help the calves start a healthy life as long as they get good colostrum levels. And so there's lots of herds that are doing that that are having great luck with that. And actually, that's what we do here at the research center. We vaccinate at final preg check on that, but we only share one border fence with any neighbors. And so our biosecurity is much better than a lot of places too. So
That's a good point. And then the last question here, what's your thoughts on a killed vaccine 20 days after calving? Could there be bad effects? And I think it relates back to exactly what you were talking about with regards to timing of breeding versus, so you want to kind of lay that in this 20 days post calving.
yeah, so if you're 20 days post calving, it really depends when your breeding season starts. So 20 days post calving, if you're on average, you're going to be about 50 to 60 days prior to breeding. What you're looking for there is you're building your highest immunity going into the breeding season. And there shouldn't be any negative there where you're out that 50 to 60 days before the start of the breeding season.
Excellent. Well, Dr. Perry, we certainly want to thank you for sharing your wealth of knowledge and expertise in this area, and we'll be looking forward to future work that you're doing in this area because it's very practical. It helps us all improve our management. At the end of the day, like you said, you can't sell a calf that isn't born, right?
That's right. So I
So
really appreciate y'all having me.
we appreciate Dr. Perry, and if we get any other questions that come on, we'll be sure to send them your way.
Sounds good. Thank you, sir.
Thanks. Thanks again.